One use of dermal fillers and injections that is kind of a little more specialized in application, and I don't see as many plastic surgeons doing this, but it's something that comes up quite a bit in my practice, is actually using dermal fillers specifically to help with nasal shape. And that's something that you hear about, like a injection-based rhinoplasty or a non-surgical rhinoplasty. As a plastic surgeon, I tend to believe that typically most of the big changes you can see with nasal shape and really getting the best result is really still through a surgical procedure. But there are some nice improvements that you can make specifically with injections. And specifically, what I see most frequently are patients who have a little bit lack of projections, sort of in terms of how far their nose protrudes this way. And they'd like to get a little bit more augmentation that way. And so for that, typically I'll use a slightly firmer filler like a Radius or something like that. Sometimes Juvenile Ultra Plus, anything that's a little bit firmer to kind of give a little bit more projection. Now it's interesting, I think there are oftentimes very individual and I would say even ethnic differences. In certain populations, typically you want the nasal projection is actually quite high and they want to actually reduce it. Certain patient populations, typically an Asian patient population, we see noses that actually don't project quite enough, and patients would like to have a little bit more projection there. And so in those patients, some filler in that area is a very straightforward, easy thing to do, give very nice results pretty immediately.